নমস্কার, আমার নাম নিমাই পাল। আমার চায়ের দোকান আছে। 6 মাস আগের থেকে বুকে ব্যথা শুরু হয়। তারপরে সরকারি হাসপাতালে দেখায়, সরকারি হাসপাতালে ট্রান্সফার করে দেয়। ট্রান্সফার করার পর আমি R N Tagore আসছি। R N Tagore এসে ডাক্তার লালিত কাপুরকে দেখাই। আমি বলি অপারেশন করতে হবে। অপারেশন করেছে, খুব ভালো ডাক্তার, আর বুকেটা ঠিক করে দিয়েছে, এখন ভালো আছি।
I'm Dr. Lalit Kapoor, working as a consultant cardiac surgeon at Rabindranath Institute of Cardiac Sciences. I would like to today tell you about a different type of operation which was done on a patient who was very sick and came to us actually rejected for surgery by many hospitals. The problem with this patient was that he had a very dilated ascending aorta, and a leaking heart valve. Now what happens in such a situation is we often do an operation which is called a Bentall operation, where you replace the ascending aorta as well as the valve. That's the rare operation, but not so rare as to merit a special mention. However, in this patient the problem was that in addition the leak of the valve had caused the left ventricle, that is the size of the heart, to become very big. In addition, there was poor flow of blood leading to damage to the kidney, and he was having a creatinine of 3.7. The normal is less than 1.2, which meant that the kidney was being damaged over this chronic disease. Having to operate a sick patient in this situation and doing a Bentall, a major operation like a Bentall, would have been a major undertaking. So all of us as a team in this hospital, the cardiologists, the nephrologists, and ourselves, the cardiac surgery team, got together to decide whether we should go ahead with such a high risk operation or not in the view of the kidney. Final decision was that if we do not repair the heart, we cannot manage his kidney. So we might as well go ahead understanding the risk. And we explained this to the patient and went for an operation where we did a Bentall. A Bentall is basically an operation where you remove the ascending aorta, which is dilated, very big and enlarged, and they replace the aortic valve at the same time. So when you do these two procedures, you have to also reimplant the coronary arteries which arise from the aorta. In itself, the operation is a difficult operation, but in the presence of a renal dysfunction, the body's bleeding tendency is very disturbed. The platelets are not able to clot, and after this long operation, they usually bleed profusely. As a result, this patient has to be prepared for the operation with lots of blood products, cell savers, and special kinds of glues to make this operation safer. We were able to manage this patient by using more than 20 units of blood and keep him in the OT for quite some time, following which he was in the ICU for about 10 days. The patient's recovery subsequently was dramatically wonderful, and he actually had a reduction of the creatinine day by day in front of our eyes. His final creatinine today at the end of a month is around 1.6, which is slowly approaching a normal value. What we want to emphasize is sometimes as doctors we have to take these big decisions where we operate patients of very high risk, where we have to take this decision to not to play safe but play a little dangerously in the interest of the patient. We can always play safe and avoid the operation, but then where does this patient go? So sometimes as a hospital of this stature, as surgeons who are taking the responsibility for patient lives, we have to come forward with the facts, tell them the truth that it is difficult, and yet take the difficult step and lead to good outcomes like this. This gentleman is actually doing so well, and he is happy to get back to his normal life. He's invited us to visit his shop in Barakpur, where he wants to have a cup of tea with us, where we can all enjoy seeing him back to being a normal man. We are happy to contribute in his life in this small way.